Hi student, today lecture 13, topic name occupational disease caused by unfavorable physical, chemical, biological injuries industrial factor, they are preventive. Industrial pollution has grown to be a problem of global proportion, serious enough to pose an immediate health hazard in some areas and a limit to future economic growth. The pollution emission and resource requirements of industry are substantial. Industrial development is essential to combat poverty and improve the quality of life. Such development may lead to serious environmental pollution and occupational health hazards, however. Measures must be taken to prevent the health problem associated with industrial development to avoid the kind of social and environmental destruction that occurred during the Industrial Revolution in Europe in the late 18th and 19th century. Early industrial sectors are responsible for most raw material consumption and most pollution. These include food and agricultural processing, metal extraction and processing cement works, the pulp and paper industry, oil refining, and the chemical industry. The degree to which development can be sustained is highly dependent on the following factors: the technology adopted, the enactment, enforcement of a compliance with regulation and international treaties. In short, industrial pollution is inextricably linked to economic development, but in ways that are complicated and difficult to separate. The main injurious professional factor at the workplace: physical, chemical, biological. Physical. At the workplace or the worker organism can influence temperature, humidity, air pressure, velocity, noise, vibration, infrasound, ultrasound, and others. Chemical, organic and inorganic substances as dust, gases, germs, metals. Biological, pathogenic microorganisms, viruses, fungi. Physical, injurious professional factors are also very common at work sites. As with the chemicals found in industry, the physical agents occupy a wide spectrum. They range from the mechanical forces of vibration and atmospheric pressure, including the rapid change in atmospheric pressure that are perceived by the ear as noise, to segments of the electromagnetic spectrum which range from radio waves and one end to radiant heat and visible and ultraviolet light, X-rays and gamma radiation, and others. High or low atmospheric pressure at the workplace. Barometric pressure above or below 1 atmosphere are part of the condition of work in special environment, such as underwater or at high altitude. The absolute pressure is usually less critical than the change experienced by the worker. The direct adverse effects of this pressure change are called barotrauma and are of particular interest in aerospace and air medicine. There are also a number of problems that result from the dissolving of gases into body fluids, or conversely, the release of gases out of body fluids. Health problems associated with compression generally occur early when there is no way in equilibrate pressure in an enclosed space. The compression effects are more common and can be severe as a person emerges from a physical environment. They occur when a diver returns to surface too quickly or when workers who are in compressed chambers, such as casein, have been depressurized too abruptly. All commercial and amateur divers are industrious in the use of diving tablets, a set of graphs and tablets that provide guidelines for ascent after diving to a given depth and remaining there for a given period of time. Failure to adhere closely established through a nation or during an emergency may result in potentially serious effects, including decompression sickness, emboli, and aseptic necrosis of bone. Caisson syndrome. A caisson is a simply a large, inverted box made to the dimension of the bridge foundation, which typically is built in a dry dock and then floated into place. People working in the pre-series caisson are exposed to compressed air and may experience many of the same physiological problems that face deep-sea divers. Acute mountainous sickness or altitude illness is a pathological condition that is caused by a lack of adaptation to high altitude. The symptoms are headache, fatigue, shortness of breath, nausea, unsteadiness and dizziness, loss of appetite, insomnia, weakness, and sometimes even seizures and coma. Oxygen toxicity. Oxygen toxicity or oxygen toxicity syndrome is severe hyperoxia caused by breathing oxygen at elevated partial pressure. The high concentration of oxygen damages cells. Oxygen toxicity syndrome may occur as a diving disorder when divers breathe and breathing gas at a higher pressure of depth. High altitude pulmonary edema occurs in 2% of those who are adjusted to altitude of 10,000 feet or more. It can be life-threatening. Symptoms: fatigue, dyspnea, headache, nausea, dry cough without phlegm, pulmonary edema, fluid retention in kidney, and rales. High altitude cerebral edema. It's a life-threatening condition that can lead to coma or death. It occurs in about 1% of people adjusted to altitude above 2,000 feet. Symptoms: headache, fatigue, visual impairment, bladder dysfunction, bowel dysfunction, loss of coordination, paralysis on one side of the body, confusion, and slowed reflex response. Influence of the temperature as a working organism. High and low temperature. Hazard associated with extremes of temperature can be divided into exposure to heat and exposure to cold. Problem arises when one or three conditions occur. Temperature variations are so extreme that they exceed the considerable ability of the body to adapt. Mechanisms of adaptation, such as vasodilation or sweating, are impaired. Exposure to extremes of temperature is concentrated on a particular body part, as in frostbite or thermal burns. The human body regulates temperature through the central nervous system from a control center in the hypothalamus, a small structure in the center. The body regulates average temperature within a narrow range centered 37 degrees. Also, core temperature is maintained approximately constant. There is continuous variation in the heat flux needed to maintain this constancy in the body. Heat is generated by metabolic process and by work performed by the muscles. Heat is also taken into the body from the external temperature is 1 degree. Heat is lost to the environment by four means: radiation from the surface of the skin, evaporation in the form of sweating, conduction by contact with the collar surface, and convection carrying heated air away from the surface of the skin or expelled air from the lung. Crude. Crude is particularly dangerous because it also reduces awareness of an injury. Temperature and air movement, called wind chill, severely affect and even kill a person who is properly protected. Both severe heat and cold are particular hazards for the very young and very old. Local cold damage results in frostbite, while cold affecting the whole body results in hypothermia. Frostbite is a local freezing of tissue that may result in irreversible damage. Extremes such as fingers, toes, and the tips of ears and noses are particularly vulnerable. Amputation of the affected area may be required in severe cases. Hypothermia is the condition of low body temperature. It's usually fatal if not recognized and treated by warming the patient. Extremes of heat can also have local or systematic effect. Local heat can result in death. Less extreme but prolonged heat result in systematic effect such as heat stress, a problem that is not limited to tropical climates or jobs involving proximity to a heat source. There are severe medical conditions that can develop as a result of heat stress, or the heat stroke is the most serious. This potential fatal condition occurs when the person can no longer adapt to the heat and collapses with failure of the circulation. It may occur in the workplace in jobs where exposure to intense heat is uncontrolled. Heat stroke is more common among people who are not used to heat and is most likely to occur during occasional heat waves, especially in cities. The combination and extreme temperature can be serious. Heat in the workplace and general environment also has its own work capacity. Traditional methods of hydration in a hot country are largely effective in protecting against the hazard of extreme heat. House building method may require air conditioning or artificial cooling system, and when the system breaks down or cannot be afforded, people are at increased risk. Next, physical. Injurious professional factor at the workplace, noise. Noise is a combination of sounds of various frequency and intensity. Sound is a mechanical vibration of a resonance medium. Its frequency from 16 up to 20,000 Hz. Noise is by far the most widespread of occupational hazard and the high incidence of noise-induced hearing loss worldwide demonstrates that it remains one of the most poorly controlled physical parameters of the noise. First, frequency. Three types of frequency of noise: infrasound, head sound, ultrasound. Noise types: low frequency, middle frequency, high frequency. Depending on the source of the noise, last divided into household, outdoor, and industrial. Very dangerous industrial noise. When you influence over working organism at the workplace. Clinical presentation of noise effect on organism are differentiated as specific hearing change and non-specific change of other organ and system. Specific result of noise effect on hearing function is the development of the occupational bradycardia and deafness. At the beginning of noise effect with hearing perceptibility, decrease may be observed. If the hearing receptibility decrease no more than 10-50 decibel and hearing is restored during 2-3 minutes, it's a temporary physiological adaptation. It's called hearing adaptation. However, when the effect of noise is prolonged, the adaptation ability is exhausted. Also, the period of restoration becomes longer. It is an evidence of hearing function fatigue. Then, the chronic fatigue is transformed to the occupational bradycardia and deafness. The cause of permanent hearing disorders is an impairment of sound preventing apparatus of hearing organ, degenerative change in hair cells of spiral organ. Non-specific. There are next clinical presentation of noise effect known as non-specific. Central nervous system disorders like rapid fatigability, weakening of memory, decrease of attention and concentration, loss of work capacity, heightened irritability. Central nervous system disorders like pulse rate change, reduction of intraventricular conduction, depression of heat electric conduction, constriction of peripheric vessels, blood pressure increase. Respiratory system disorders like respiration rate and intensity. Organ of sense and eyesight disorders like weakening of twilight vision, perceptible change to a different part of spectrum light. Vestibular apparatus disorders like garish, unsteadiness, and others. Digestive system disorders like depression of gastric juice secretion, gastric and intestinal peristalsis decrease. Endocrine gland disorders, metabolic disorders, blood system, and others there is also non-specific effect if you influence of worker organism noise. Noise at a workplace causes development of occupational disease, noise disease. Characteristic feature of noise disease is disorders of asteno-vegetative and asteno-neurotic syndrome. Development of this syndrome precedes the hearing function impairment. In 1976, over more than 14 million industrial workers exposed to noise in USA. Production industries. 30% were exposed to noise of 85-90 decibel, 30% to level higher than 90 decibel, and 30% to level lower than 85 decibel. The percentage of workers whose hearing is permanently impaired double as their exposure to noise increase from 80-85 decibel and double again from 85-90 decibel. The Occupational Safety and Health Administration permits in upper limit of 90 decibel and has proposed a reduction to 85, which would bring at least 70% of me-exposed workers under mandatory protection. The change has been strongly opposed by industry on economic growth. Noise also produces effect beyond reduction of hearing ability. As in any environment, noise at work fosters stress. It heightens tension, adds to fatigue, interferes with concentration, makes communication difficult, and in general detracts from the quality of life. In an office, noise distraction can produce stress without inducing hearing loss. Masking systems have been instituted in some work environments. Called white or pink noise, the making sound resembles a sustained hiss. The system were designed to eliminate distracting noise by covering them up. However, the long-term effects of the making sound are not yet. Measures. Use of individual protection equipment as earmuff, isolation of the workplace from the noise, using soundproofing material in the building industry, health education, regular medical examination, regular control of the noise level, frequency and intensity, regular control of the blood pressure before and after work, check the pulse during the work day. Vibration. Vibration is a periodical deflection of a solid body from its balance, or in other words, vibration is a mechanical oscillation of elastic body. Type of vibration exposure: total, segmental, vibration effect local and general. Type of vibration: low frequency, medium frequency, and high frequency. About 6 million USA workers are exposed to some form of vibration. According to the Earth Health Organization data, vibration disease in the Czech Republic 8.8%, in Bulgaria 6.8%, in Hungary 6%. They are less prevalent in Western countries comprising, for example, 0.2% of occupational disease, vibration disease in Finland and 2.4% in Germany. This probably indicates the positive impact of modern advanced hand tools and the introduction of fully mechanized drilling machines for such works as mining and quarrying. The scientific basis for standard setting is, however, still activity debated. Nevertheless, there is a wide agreement that the duration and level of exposure to vibration should be reduced to the minimum. Types of vibration exposure divided to groups. Total, named as whole body vibration, and segmental, arm-hand, named as hand-arm vibration. Whole body vibration. Not much is known about the chronic health effect of whole body vibration, although it may be considered to induce stress. At some frequency, the human body may be in resonance with the vibration, thus amplifying it. When the body is in resonance, it is thought to be most susceptible to the vibration effect. Whole body vibration can cause an increase in oxygen consumption, increased breathing, and short bursts of rapid heat rate. People exposed to intense low-frequency vibration occasionally feel unstable. The long-term health effects of whole body vibration have been alleged to include injury to the bone structure, gastrointestinal tract problem, varicose veins, enlargement of scrotal veins, and pain. Workers also report a weakness, loss of appetite, nausea, and irritability. Occupations where workers may be at risk to whole body vibration include truck drivers and terminal workers, farm vessels and tractor operation, intercity and local bus drivers, heavy equipment operators, foundry workers, metal stamping operators, and others. Segmental vibration. The most pronounced effect of hand-arm vibration is Round's phenomenon, or vibration white finger, an episodic disturbance of blood flow in the finger. The first symptom of vibration white finger is both of blanching of the finger. This becomes more frequency, longer, and more severe as the disease progresses. Other effects are numbness and some loss of muscles control and reduction of sensitivity to heat, cold, and pain. Eventually, the person with vibration white finger loses the ability to use the fingers in a fine task, such as picking up coins of buttoning clothing. Vibration white finger is often not recognized as compensable as an occupational disease, although it may severely restrict the victim's employment opportunities. The time period between beginning work with vibrating tools and onset of symptoms can be as short as several months. The extent of the problem in most industries using vibrating tools is not known. Other effects of segmental vibration include bone change, muscular weakness, and degenerative alteration, inflammation of the tendons, bone cysts, and vascular change. Vibration effect depends on the body pulse. In the room, the vertical vibration in standing position is more harmful. The harmful vibration effect depends also on the level of air temperature and humidity. The vibration effect is increased in conditions of low temperature and high relative humidity. When the instrument is heavy and produces vibration with big amplitude, its effect on the body is very harmful and may cause the trauma. The harmful effect of the vibration on the body also depends on the level of the temperature and relative humidity in the workshop. Type of vibration exposure and vibration effect, local and general. local. Disorders of the peripheral blood circulation, spasm of the capillaries, and pale skin. Disorders of the peripheral nervous system function, hypersensitivity, and severe pain in the hands, especially after washing with cold water. General inflammation and deformation of the joints, bones, chronic headache, drowsiness, disorders of the movement. Common symptom, vibration disease. The impact of vibration is not restricted to the application place and reflexively passed to the next level of the nervous system, affect the brain and spinal cord. The change in the central nervous system occurs mostly on the type of functional neurosis, asthenia. There has been a headache, fatigue, dizziness, irritability at women, tearfulness. All the symptoms may be more severe if the generalization, cardiovascular autonomic disorders, at individuals may develop narrow circular vascular creases. Vascular creases may be played in the vessels of the brain. In this cause, their paroxysmal dizziness. The same type of violation can be from the coronary vessels. In this cause, the effect of angina. There are 4 stages of vibration disease. The initial stage, practically healthy people make individual light displays in the form of reduced sensitivity, skin temperature, change during capillaroscopy, minor revealed a tendency to spasm, several altered tropism of muscles of the shoulder girdle. At this stage, the process is completely reversible. Stage 2, a complex of symptoms. Persistent paresthesia, a significant reduction in skin temperature, sensitivity of the fingers, persistent spasm of capillaries, at the muscular system, inflammation of muscles, ligament, at the activity of the central nervous system, osteoneurotic reaction. The process is completely reversible with complete cessation of work in the condition of vibration, the symptomatic treatment. Stage 3, both of finger blushing, a symptom of dead fingers, changing paresis, capillaries, and sharp cyanosis. There may be both a cramps in hands, reduced sensitivity of the segmental type, indicating red lesion in the spinal cord. Stage 4 occurs in the ear. Generalization of vascular process, violation tropism until necrosis on the extreme. Preventive measures. Using the instrument with low frequency vibration, interval in work for 10 minutes every hour of work, using the personal protection equipment, periodically analysis of the vibration frequency level in the work, using the show by workers after workday completion. The worker requirements in vitamin B1 are higher than daily requirements in about 50%. Using UV rays lamps, especially in autumn and winter, periodical medical check-up of the worker, health education. Laser, which stands for light amplification by stimulated emission of radiation, is light that has been synchronized such that the radiation is of one specific frequency and the light waves are all traveling in fast impulses. Today, laser application in the industry, different science, agriculture, medicine, and biology. Basic parameter of laser: wavelength, intensity of irradiation, pulse time, pulse repetition frequency. Laser visible light is one type of non-ionizing radiation. Damage caused by laser divided 4 categories: harmless, low harmful, middle, and high. Harmless, on action on eyes harmless. Low, the direct action laser, low harmful. Influence of laser on human organism: local, direct on the eyes, local, direct on the skin and general on the body. This delivers much larger energy directly to the eyes than normal light. Laser light of high energy can therefore be extremely damaging to the eyes and can even burn the skin or other materials. Although laser light is an occupational hazard in occupational setting, the lack of sufficient lighting, particularly in the work environment, is a much more general problem. Poor lighting increases the risk of injuries in factories as well as on roads and increase eye strain in people who have to read or perform precision tasks in their work. Eye strain can lead to headache and various psychosomatic symptoms. The lighting needed for the fine task increases significantly with age because of the natural deterioration of eyesight with age. A 40-year-old person needs twice as much light as a 20-year-old person to see an object with the same clarity. However, because lighting consumes energy and this increased costs, many factories and homes are poorly lit, especially in poor countries. Local direct on the skin and general on the body. Laser influence skin, redness and maybe burns. Internal organ may stimulate central nervous system function, dysfunction of the blood vessels, sweating, exhausting, and unstable blood pressure. Preventive measures. Special protective eyeglasses applied. Protect the skin and the mucous membrane against the direct effect of laser. Control the sanitary condition of the air. Proper ventilation. Use protective screen. Use special glove. Periodical medical check-up examination of the medical person. Chemical hazards at the workplace. Industrial toxicology is considered the adverse effect on workers of substances handled in the workplace. Also, interest usually extends to adverse effect of products on consumers and the workplace influence on the public. Historically, toxicology was the art and science of puzzle. It's today a discipline which makes use of information developed by a wide range of chemical, physical, biological, and medical science in order to predict the likely adverse effect on man of an ever-increasing range of substances to which he is exposed. Term toxicity is the innate ability of substance to injure living things. Hazard assessment is the prediction of the toxic effect that will be evident under defined condition of exposure. The toxic effect of a substance depends upon its physical form, dose, the route of entry, its absorption, distribution, metabolism, and excretion. Toxin is a substance which may cause human disease or injury. Approximately 10 million chemical compounds have been synthesized in laboratory since the beginning of the present century. About 1% of these chemicals are produced commercially and used directly. There is virtually no sector of human activity that does not use chemical products, and these products have indeed created many benefits for society, such as the treatment of disease with pharmaceutical products and the use of fertilizers to increase food production. All chemicals are toxic to some degree, with health risks being primarily a function of the severity of toxicity and the extent of exposure. However, most chemicals have not been adequately tested to determine their toxicity. It's important to distinguish hazard and risk from the term toxicity. A high toxic substance will damage an organism even if only very small amounts are present in the body. A substance of low toxicity will not produce an effect unless the concentration in the toxic tissue is sufficiently high. Classification of chemical substances include: first, chemical, action on a human organism, class of harmful. Chemical classification include inorganic chemicals, organic, element organic, inorganic, which contain none or very few carbon atoms, organic, which have a structure based on carbon atoms, element organic, chlorine, mercury, for example. Waste, toxin, enter and excretion from the body. Toxin enter the body through breathing system, stomach, skin. Excretion, kidney, intestine, lung, mammary gland. The level of the biological effect of the chemical elements of the body depend chemical structure or physical chemical character, absolute volatility, molecular weight, specific gravity, boiling point temperature, dispersion, aggregation, the level of solubility in water and liquid. Action of the human organism by chemical substance causes neurotrope, hepatotrope, nephrotoxic, cardiotoxic, blood poisoning, poisoning causing hypoxia and ataxia. Addictive action, parotoxic effect, metatoxic, type of poison, acute, chronic, on localization of the pathological process, local, general, specific. Specific include mutagenic, teratogenic, and reproductive action. To find out the class of harmful, we need to find out the following indexes. Analysis usually provided in laboratory, studying the influence on the laboratory animals. CL50, middle deadly dosage, concentration, the quantity of which may cause a death of 50% of standard group of laboratory animals after poisoning. Second, coefficient of inhaler poisoning. Third, zone of severe influence. 4, zone chronic influence. 5, limit of admissible concentration. Class of harmful toxicity. First class, cause atherosclerotic change in different internal organs, as pneumosclerosis and neurosclerosis. Second class, influence the nervous system and cause convulsions with neuroparalytic effect and drug effect. Third class, influence the blood, depress the function of the bone marrow. Third class, cause irritation of the mucous membrane of the eyes, upper pain of the breathing system and the skin. And fifth class, limit of admissible. Example, occupational poison at the workplace. Inorganic substance, halogens, are elements that form a cell by direct union with a metal. We include fluorine, chlorine, bromine, and iodine. At standard temperature and pressure, fluorine and bromine is a liquid and iodine solid. When placed in water, reaction yielding acid that irritated tissue. As individual elements and compounds, the halogens have inherent toxicity. The primary correlation of halogens is a respiratory tract irritation, with severity depending on concentration. Chlorinated and fluorinated hydrocarbons, which are reaction of halogens with organic compounds. Corrosive material include alkaline compounds, such as ammonia, calcium hydroxide, calcium oxide, potassium hydroxide, sodium carbonate, and sodium hydroxide, among others. This causes corrosive local irritation of tissue, such as the skin, eyes, and respiratory tract. This effect can also be caused by acids. Sulfuric acid and chromic acid are common industrial chemicals. Other compounds with corrosive or irritation effect include the common air pollutants, ozone and nitrogen oxides. Ozone is very irritating to our mucous membrane, eyes, nose, mouth, whereas nitrogen dioxide is a moderate irritant. Both can trigger asthma attack. Metal at the workplace. Metal, such as cadmium, chromium, copper, lead, mercury, nickel, and arsenic, are toxic and environmentally persistent. Always chromium, copper, and manganese are essential metals in that they are required by living organisms. Both the environmental fate and the level of toxicity of metal depend strongly on the physical and chemical form. Mercury. Mercury is also an accident hazard. However, it's much less common as an industrial pollutant than lead. It's inequal among metals, being a liquid at room temperature and readily volatilizing into a gas. There are many organic compounds of mercury, and this is usually more toxic than the metal element itself. Exposure usually occurs through inhalation of mercurial vapor or ingestion of mercury-containing food, but mercury can also be absorbed across a wound or damaged skin. Historically, mercury was primarily an occupational hazard, associated with goldsmithing, mirror making, explosive detonators, and the many uses of mercurial compounds as antiseptic and antifungal agents. The use of mercurial compounds as an antifungal treatment of seed intended for planting has caused several outbreaks of mercury poison, the most famous being in Iraq in 1972, in which hundreds of fatalities occurred among people who used treated seed to make bread. Industrial pollution with mercury was mostly on a small scale until the 1940s, except for some mercury contamination of body of water from gold mining. However, industrial pollution on a large scale resulted when the chlor-alkali process was introduced in paper plants and production expanded during the post-World War II era. This has resulted in substantial mercury contamination in many bodies of water, particularly in the sediment where the mercury accumulates. However, the largest outbreak of mercury intoxication in history was the result of pollution from a vinyl chloride factory that used a mercury catalyst in its production process. This occurred in 1953 in Minamata Bay on the island of Kyushu, Japan, resulting in many deaths and a much greater number of individuals with permanent neurological impairment. Effluent from the factory caused methyl mercury contamination of fish which were eaten by village. Today, in most developing countries, mercury is primarily an occupational hazard in dental clinics. From the use of mercury-containing amalgam for filling cavity, instrument manufacturing and repair, and smelting. Some causes of mercury intoxication have occurred in bones. For example, where a space heater has been used with a broken mercury-containing switch that was designed to shut the heater off if it leaked over. In some areas of the world, such as the Amazon, mercury pollution is on the rise. When gold was first discovered approximately 3 decades ago in Brazil, thousands of impoverished Brazilians began to extract gold from a river sediment by mixing in mercury as a liquid metal beans with the gold. The resulting amalgam is heated, causing the mercury to evaporate, leaving the gold behind. Through this process, large amounts of mercury were released into the air as well as into the water. The effect of mercury on the body can take many forms, depending on the chemical form of mercury and the circumstance of exposure. Metallic mercury can cause mouth sores, extreme pain, and tenderness in the fingertips, tremor, and unusual pathological shyness that result from damage to the brain. In the environment, metallic mercury is slowly converted to organic compounds of mercury. Methylmercury compounds may cause severe nervous system damage, both to the brain and the peripheral nerves. This is associated with movement disorders, deteriorating handwriting, slurred speech, and visual abnormalities. The acute poisoning by mercury is very rare, usually chronic poisoning as a result of influence of small concentration of mercury on the body for a long time. Clinical picture: acute poison, headache, drowsiness, general weakness, abdominal pain, bloody diarrhea, hypersecretion of sweat glands. Chronic poison: motor weakness, spongy gums, abdominal colic, tremor, bleeding from the gums, mercury stomatate, weakness of the teeth, and hypersalivation. Next example, lead poison. Lead is one of the oldest environmental hazards known to society. There are many sources of exposure to lead, with the residents in urban areas tending to have lead levels that are higher than those in rural areas. Lead enters the body primarily through the inhalation of tiny particles that contain it or through ingestion of food or beverage that contain it. Absorption of tetraethyl lead gasoline additive through the skin does occur, but such exposure have really caused lead poison. Petrol sniffing among youth in certain communities has caused significant poison problem. Lead remains a serious environmental hazard as well as a serious occupational health and safety problem. Lead was used long before the Industrial Revolution for making pigments, and bolts because of its soft metal. It's easily worked and metals at a relatively low temperature. Industrial pollution by lead has been a particular problem in smelters. Primary lead smelters handle ore that contains high concentration of lead. Other types of primary smelters may be associated with a risk of lead exposure because lead is often present in the ores of other metals. The most common type of point source for industrial pollution by lead, however, has been secondary smelters where all lead batteries are torn apart, melted down, and resmelted. The secondary smelters are often located in populated areas and lead contamination of soil around them can be extensive. Industrial pollution from lead, however, is a more general problem because of leaded gasoline and lead-containing paints for indoor application. Tetraethyl lead additive was for many years a major contributor to environmental lead exposure in communities. Leaded gasoline has been withdrawn from the market in most countries, and where it has the lead levels in the blood of children have decreased. Another major source of community exposure to lead has been house paint containing lead. Children who eat flaking paint chips or who play on the floor where there is lead containing dust from disintegrating paint are at risk for lead poison. Currently, lead containing paints are usually restricted to heavy duty outdoor painting of steel bridges and other non-residential structures. However, paint stains on buildings for a very long time and a painted building older than 30 years may still have lead paint. Another important source of lead exposure was lead-based glasses on pottery. Commercial production of pottery with lead glasses has stopped in most of the world, but the problem is still seen occasionally when a lead glass is used by an amateur or when a decorative piece not made for drinking is used as such. Small amounts of lead may also enter the body from the food cans or copper drinking water pipes because solder was used to seal them. Clinical picture lead poison. Heavy exposure to lead can result in lead poison, which is characterized by anemia, kidney damage, nerve damage, and partial paralysis of certain muscle groups, and brain damage. The symptoms of acute lead poison are colic pain in the abdomen, nausea, and weight losses. The effect of lead exposure that cause the greatest concern are those of children. Low levels of lead exposure may cause irreversible brain damage that takes the form of learning disability and reduced intellectual capacity. In some time may cause cancer. Next example, zinc poison. Zinc, used in manufacture of alloys as a component of brass in batteries and paint. Zinc absorbed by inhalation through gastrointestinal tract and injured skin. Clinical picture, acute zinc poison, vomiting, diarrhea, fever, muscle pain, renal dysfunction, sweating, joint pains. Chronic poison, dysfunction of the liver, anemia, papillary follicles. Benzol poison. Benzol is a high toxic element with nice specific odor. Boiling temperature 80.1 degree. Usually benzol used in lacquer paint production, different chemical process, pharmacological, machines building, and textile industries. Benzol enters the body through respiratory system, skin, after the effect, the central nervous system, narcotic effect, blood system, and the irritation, redness, and others. Clinical picture, acute benzol poison, headache, drowsiness, general weakness, and maybe concupiscence, depend on the concentration of the benzol. Chronic, damage and dysfunction of the leukocyte function, leukopenia, headache, loss of appetite, general weakness, drowsiness, hemorrhagic epigastrics, and others. Preventive measures of chemical poison at the workplace. To forbid children up to 70 years, pregnant and mothers of baby with natural feeding to work in this type of factory. Prohibit anyone with anemia, liver and kidney disease, peptic ulcer and disease of nervous system to work in this factory. Provide regular medical checkup of worker. Minimizing environmental pollution. Proper ventilation. Periodically measuring the level of chemical agents in the air of workplace. Use of protection instrument and special cloth. Regular finding out the class of dangerous of chemical agent. Health education. Air working area has mechanical property which depend on the solid particles like dust. Dust is the most widespread harmful factor in industrial area, is in factory for building material, also as a result of boarding and reading in means, machine building, metallurgy, and cement factory. Dust classification, chemical structure, ways of formation, dispersion, conversion degree, dust lesion. Kind of dust, natural, for example, sea, cosmic, volcanic, and artificial, for example, jewel composition. Chemical structure, organic, for example, natural dust, wood, woolen, artificial, plastic, rubber dust, inorganic, mineral dust, for example, cement, quartz dust, metallic, zinc, iron, And third group, mixed, the dust formed in chemical industry. Ways of formation. The integration aerosol is formed in mechanical crushing of solid substances. Condensation aerosol is formed at thermal process fusion. Dispersion, visible dust particles more than 10 micron, microscopical particles dust from 0.2 to 10 micron, and ultramicroscopically less than 0.2 micron. Dust lesion, specific pneumoconiosis, allergic disease, and non-specific bronchitis, tracheitis, pneumonias, conjunctivitis, dermatitis. The solid substance suspended in atmosphere air, a dust or natural and artificial cause. The natural dust is forlorn, cosmic. On the ground from space a quantity of thin particles which are not having particle value settles. Volcanic sea is formed as a result of drying spray of salty water at excitement of the sea also has no particles value. Forest fires and soil have the greatest hygienic meaning. The natural dust consists of a soil dust. It rises in air from a surface of ground as a result of moving air streams. This is promoted especially by movement of means of transport and a plant's dust. The 70–80% of soil dust of a populated areas located in desert and semi-desert are mineral compounds with the high concentration of the free silicon dioxide. But the change of silicoses causes the slender. The plant dust is a pollen of flowering plants, mushroom spores, and bacteria. The dust of artificial origin gets into air variety in the form of ashes and carbon black. The dust can have direct and indirect adverse effects on the people. Indirect effect of dust in atmosphere consists in reduction of intensity of sun radiation and in formation of overcast and fogs. It results in decrease of natural daylight over premises and is consequence in short-sightedness and rachitis of children, osteoporosis of adults, survival of pathogenic microbes, and environment. Direct effect of dust: irritating, mechanical, carcinogenic, toxic, epidemiological, fibrogenesis, BIM, allergic. It can be absorbed in adverse working environment. Change in the respiratory system and dust influence. The major function of a respiratory system is gas exchange between the external environment and the circulatory system. This involves taking in oxygen from the air to the blood and releasing carbon dioxide from the blood back into the air. Upon inhalation, gas exchange occurs at the alveoli, the 26 that are the basic functional component of the lungs. The alveoli walls are extremely thin, approximately 0.2 micrometer. These walls are composed of a single layer of epithelial cells in close proximity to the blood capillarity, which in turn are composed of a single layer of endothelial cells. The close proximity of these two cell types allows permeability to gases and hence gas exchange. Oxygen is taken into the blood, whereas excess carbon dioxide is released. Despite the efficiency, large volume of particulate can overwhelm this defense mechanism. Irritation caused by gases and fumes produce inflammation of respiratory tract, and the symptoms tend to be acute or delayed depending on the solubility of the toxic agent. They can also be chronic effect. Chronic effect from prolonged exposure may be chronic bronchitis and permanent lung damage. Allergic reaction to substance can cause occupational asthma. Pneumoconiosis is the reaction of the lungs to inhaled mineral dust and the resultant alteration in their structure. The major causes are coal dust, silica, and asbestos, and they all lead to scarring of the lungs known as collagenous fibrosis. Pneumoconiosis may not produce any symptom for air. However, as the lungs become less flexible and porous, their function is greatly reduced. The symptoms include shortness of breath, cough, and general feeling. The shortness of breath usually begins early with severe excretion. As the disease progresses, shortness of breath may be present all of the time. The cough initially is not associated with sputum, but may eventually be associated with coughing up blood, due to poor oxygenation of the blood by the damaged lungs. The nails and lips may appear pale or bluish. Chronic obstructive pulmonary disease refers to chronic bronchitis and emphysema. There are two lung diseases which often occur together and result in the airways becoming narrowed. This leads to elimination of the flow of air to and from the lungs, causing shortness of breath. Unlike occupational asthma, the narrowing of the airways is not easy to reverse and usually gets progressively worse over time. Chronic pulmonary obstructive disorders can be triggered by a wide range of particles and gases which cause the body to produce an abnormal inflammation of the issue. Malignant tumors of industrial origin can affect the lung and surrounding tissue. Lung cancer has been discovered in people working with asbestos. Chromium pigment manufacturers, polycyclic aromatic hydrocarbon, coal gas manufacture, tar workers, and ionizing radiation, uranium miners, wood dust, hardwood, furniture makers, and others. Dust pollution throughout into the air by power system as the quantity of the last constantly grows has the greatest practical value. Thus, the role of industrial enterprises and house heating system can vary depending on local condition. In some places, the leading role take place the industrial enterprises, in others play house heating system. But as well, the industrial enterprises are the leaders. On the data received from many countries is marked that with development of the industry, the amount of the pollution acting in air proportionally increase. Especially many firm pollution act in air at burning firm fuel. Thus, in air throughout ashes, soot. Ashes represent as non-flammable impurity to coal, which contains it can vary from 6–12% high-grade coal up to 35–36% lower grade, and the burning represent not burnt down particles of coal, which quantity depends on the degree of aeration of fire installation. Very important in the hygienic practice dust dispersion. Particles larger than 10 micrometer. Large particles that enter respiratory system can be trapped by the hairs and lining of the nose. Once captured, they can be driven out by a cough or sneeze. Small particles that may enter the tracheobronchial system can be captured by mucous work back to the throat by tiny hair-like cilia and removed by swallowing or spitting. Particles smaller than 10 micrometer. These particles may make it into the lung, but depending on their size, they may or may not be deposited there. Some particles are so small that they tend to follow the airstream into the lungs and then right back out again. Particles truly between 0.5 and 10 micrometer may be large enough to be deposited in the lungs by sedimentation. Sedimentation is most effective for particles between 2 and 4 micrometer. Particles no less than 10 micrometer are most important from view of adverse health effect on human. High particulate concentration in the atmosphere, especially in conjunction with oxidation of sulfur, respiratory infection, cardiac disorders, bronchitis, asthma, pneumonia. Some particles are toxic. Many carbonous particles, especially those containing polycyclic aromatic hydrocarbons, are suspected carcinogens. Particulate emissions have decreased substantially in the past few decades due to tremendous reduction in combustion emissions, especially by electric utilities. Character of dust effect on organism is diverse and depends on dust property, and especially on chemical structure. The dust particle of some chemical substance have a marked strong toxicity, and getting to organism they can cause poison. This kind of dust are dust of beryllium, vanadium, cadmium oxides, lead, thorium. The dust which has not marked toxicity can bring to development of chronic non-specific disease of the lung. This effect is revealed in productive reaction with development of connective tissue, pneumoconiosis, and also bronchitis, tracheitis, pneumonias, conjunctivitis of dust etiology. Classification of pneumoconiosis disease caused by mineral dust, silicosis, silicatosis, caused by metallic dust, siderosis, berylliosis, caused by coal dust, anthracosis, graphitosis, caused by organic dust, buzinosis, caused by mixed dust, silica asbestosis, silica anthracosis, and others. Some kind of dust causes granulomatosis process, beryllium dust, in lungs and other organs. Anthracosis caused by inhalation of coal dust. The other kind cause allergic disease, for example, a food dust and plant dust. Crystalline silica. Crystalline silica or quartz is the most widely occurring of all minerals and is found in most rock. The most commonly occurring form of silica is the sand found on beach through the wet. In the dry form, fine crystalline silica constitutes a toxic hazard since its inhalation as airborne dust could give rise to silicosis. Silicosis is a pulmonary fibrosis which is regarded as the most common and severe of all pneumoconiosis. The risk of developing the disease depends on three factors, namely dust concentration in the atmosphere, the percentage of free silica in the dust, and the duration of exposure. Silica is encountered during many processes which use minerals, wiring and mining, brick, steel, and refractory manufacture. Glass manufacture. At the beginning of this century, fatal causes of silicosis with a rapid evolution period, 1-3 years, were not uncommon among workers who inhaled enormous amounts of dust containing a high quartz content. In many instances, this was due to the superimposition of tuberculosis. With the introduction of improved working conditions and modern method of dust control, this rapidly evolving form of silicosis has virtually disappeared but has been replaced instead by the very slow developing 15-30-year form of the disease. The initial stage of silicosis are asymptomatic and are early revealed by periodic radiological examination of workers exposed to free silica. The first symptoms of silicosis are loss of breath on exhalation. In the serious cases, the symptoms occur even on very slight excursion or when the patient is at test. As a rule, there are no another subjective symptom. Thus, the diagnosis of silicosis is largely by clinical examination and radiology. Clinical picture: silicosis disease. First stage: chest pain, dyspnea after physical activity and dry cough. Second stage: dyspnea, chest pain, wet cough, and signs of emphysema. Third stage: dyspnea and decrease of lung capacity, chest regain show multiple fibrosis formation. Preventive measures of dust pollution: technological, sanitary, medical prophylactic. Technological include use of new technology. Sanitary: hermetic sealing of the equipment, ventilation, use of personal protective facility, for example, respirator, dust protection coveralls, glasses. Medical prophylactic method: preventive include carrying out of medical examination of worker, UV radiation in photari, alkaline inhalation, diet, and vitamin. Today, most of the world countries are developing countries and most of the poverty in rural. Biological hazard include all of the forms of life that can cause adverse health effect. Biological hazard divided to groups: natural, anthropogenic, zoonotic, industrial, antibiotic, means of protection plants, facilitators of growing, vaccines, and others. These hazards are plants, insects, rodents, and other animals, fungi, bacterial, viruses, and a wide variety of toxins and allergens. A recently discovered type of biological hazard has been called prion, disease-producing protein particles, which have been related to a number of diseases, including Creutzfeldt-Jakob, mad cow disease. The ways of enter biological factor in the organism: infected of the clothes, dirty hands, dirty dishes, contact with sick animal, transmissible waste through insect, aerogenic. Environmental health is largely determined by the health effect of exposure to microorganisms and parasites. Thus, occurrence and spreading depend on environmental factors. The biological factors that play a role in the life cycle of organisms are discussed below. Hazards associated with larger species will be treated as an issue of physical safety or as a hazard in transmitting infection. Microorganisms of concern in environmental health include bacteria, viruses, and protozoa, such as amoebas. Most microorganisms and parasites that cause human illness need to grow inside the human body to cause it harm. Bacteria and protozoa may live and multiply outside other living cells, and they can survive and multiply for long periods in food, items, or water, as long as there are enough nutrients for them and the pH and temperature are within viability limits. Viruses, however, cannot multiply outside of other living cells, although some can survive for long periods and remain infective. To sustain their life cycle, viruses need to enter in the human cells or the cells of an animal, insect, or plant. Many diseases caused by microorganisms are spread directly from one person to another. This disease, considered person-to-person environmental health hazards, include tuberculosis and many infectious childhood diseases. The 5 major infection killers in the world are acute respiratory infection, diarrhea, tuberculosis, malaria, and measles. When a disease can spread from one person to another, it's called an infection or communicable disease. The spread can be direct, by contact between two persons, as happens with sexually transmitted disease, or it can be transmitted by air, as with the common cold or tuberculosis. One infected person exhales the microorganism that cause the disease, and another person inhales the contaminated air. The spread can also take place through vessels other than air, in materials that have been contaminated by an infected person. Food contaminated with worms emits from another person. Infection with the human immunodeficit viruses or with the hepatitis B virus can occur from needles, thick injuries, or blood contact, and understandably is widely feared. Leptospirosis, a bacterial infection spread by contact with latrine, occurs in some occupations and at risk in the sugarcane industry. Brucellosis is another disease in farms and slaughterhouse workers and is caused by contact with cow, pigs, and goats. Vectors, animals or insects that carry the microorganism or parasite and infect a person via a bite. Malaria via mosquitoes can spread disease as well. Certain bacteria and parasites produce toxins that can cause disease through the poison action of the toxin rather than an infection. Much food poison is this type of bacteria-produced toxin reaction. The difference between infection and toxic reaction is important. Diseases that are caused by the toxin that bacteria produce are not contagious, but if they do not spread from person to person, but are limited to the people who consume the contaminated food. Thus, there is no subsequent risk to another people when the toxin causes the disease. Notice the precautionary measures taken to prevent both bacterial infection and bacterial toxin are similar. Many biological agents, viruses, bacteria, parasites, fungi, molds, and organic dust have been found to occur in occupational exposures. Type of work in relation to a biological factor. First, related to the microorganism. Production of biological preparation, using biological preparation for prophylactic and treatment of different diseases, using the microorganism for teaching and scientific work, work with water and soil, work in hospital. Second group, related to the animals. Is work in rural area, slaughtering, meat processing. And third, related to the plants. Some 25 occupational groups are exposed to about 200 biological agents. An estimated 6.7% of the workforce in the Netherlands is exposed, and 14–50% of the workforce in Finland may be exposed to various kinds of biological agents. Exposure to organic dust and allergic chemicals has been reported to the World Health Organization, but reports of occupational asthma and other allergic responses are very few. Asthma completes about 1% of occupational disease in the Czech Republic, in contrast to 4% in Finland, where the total for all allergic respiratory disease is 10%. Exposure to biological agent or organic dust and the related health hazards are growing in many countries, such as Germany and Sweden. The precise mechanism involved in the causation of disease are often not fully known. An underlying immunological and or inflammatory reaction is usually involved. If exposure is not controlled, permanent incapacity to work soon follows the onset of disease. Preventive measures, influence of biological injurious factor as a worker organism include periodical medical checkup examination of worker organism, control the sanitary condition of the air, especially in workshop, disinfection method, using of individual protective clothes and instruments, health education. Thank you for attention.